Today's show is sponsored by strawberry.me. As nurses and future nurses, so much of what we do revolves around solving problems. So that when it comes time to focus that attention on ourselves, it can sometimes feel overwhelming. I've recently felt so overcommitted and like my days just spiral out of control. So I decided to try something new. I decided to try personal coaching with strawberry.me. It has been so incredibly eye-opening. My coach Anne asks me such great questions and helps me focus on what really matters. She's not telling me what I should do. She's helping me discover what is going to help me reach my goals. With Anne's help, I've set up consistent routines and daily habits that have made a huge difference in my overall well-being and help me feel like I'm finally back in control of my days. With strawberry.me, you're connected with a coach who's perfect for you, often in as little as 4 hours. And I love that Anne checks in with me periodically to see how I'm doing. It's a great motivator and reminder of the goals I've worked toward. Visit strawberry.me/nursemo. That's strawberry.me/nursemo and take charge of your future with the help of a certified coach. And get a $50 credit when you sign up at strawberry.me/nursemo. Well, hello there, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes I release on Thursdays. So today we are talking about what you should be doing and thinking when your patient is having PVCs or premature ventricular contractions. So the first thing I want you to do is don't necessarily panic, okay? You're going to do a little bit of assessment and then you can take steps to hopefully resolve those PVCs. So first, determine the frequency of those PVCs. When they occur occasionally, we say they're infrequent. Or if they're happening occasionally with no discernible pattern, but they are frequent, you would then say frequent PVCs. But a lot of times there's a pattern. For example, if they occur every third beat, so if every third beat is a PVC, that's called trigeminy. If they occur every other beat, that's called bigeminy. And obviously, bigeminy is going to be way more concerning than trigeminy. And both of these are going to be more concerning than your patient who's having the occasional infrequent PVC. Again, the more frequent they are, the more concerned you're going to be. Second, look to see if hemodynamics are affected. What's going on with your patient's blood pressure? Check your patient's blood pressure, compare it to their baseline, and you can get an idea if those PVCs are affecting the patient's blood pressure. And if they are, if that blood pressure is lower than you expect it to be, this is also going to ramp up your level of concern. Now, in addition to assessing the blood pressure, you also want to determine if the PVCs are actually perfusing, because guess what? Sometimes they're not. So a quick way to do this, if your patient is on a monitor, you could look and see that the heart rate on the EKG tracing is, say, 65, yet the pulse oximeter reading is 45. This probably means that the PVCs aren't perfusing. Another way to assess that is to look at what the monitor is showing for their heart rate and compare that with a manual palpated radial pulse count. If they're not matching and you have a mismatch there, good chance those PVCs aren't perfusing. Now I'm getting even more concerned. And in most cases, if the PVCs are non-perfusing, guess what happened to your blood pressure? That's why your blood pressure is low. And then the other key thing is check your patient's potassium and magnesium levels. Those are going to be the two key electrolytes that can affect the heart in this way. Hypokalemia and hypomagnesemia, really common reasons for frequent PVCs. In lots of cases, this is going to be why. Now, if those K and MAG levels are low, what are you going to do? You're going to call the MD, you're going to let them know what's going on, and you're going to get an order for electrolyte replacement. And in a lot of cases, that right there fixes your PVC problem. So when your patient has PVCs, whether they're frequent, infrequent, or happening every other beat, don't freak out. Get your data. You're going to look at how frequently they are happening, if there's any kind of pattern with that, determine if hemodynamics and blood pressure are affected, and check their potassium and magnesium levels. Then you're going to call the physician, get a plan in place, and get in there and do what you need to do for your patient. I hope you enjoyed this quick, short Mo's Monday Minute episode, and I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Hey everyone, it's Dan Souza from America's Test Kitchen. I'm super excited to let you all know that we're launching a new video podcast that takes you behind the scenes into the messy, imperfect, but riveting day-to-day life right here in our test kitchen. Not only do I get to talk to my colleagues about the latest taste test they attended.
I just came from a tasting of salted caramel apple pie bars and then roasted garlic, so I apologize.
Or about a recipe they're developing.
The thing about this recipe is it's a secret. The restaurateur refuses to tell people what her secret ingredients are.
We also chat with amazing guests from the culinary world and beyond.
The lamest joke I've ever said, and I said to Marie Bamford.
Great.
It's
Definitely
great
said worse.
joke.
Thanks, Anna.
Make sure to subscribe to In the Test Kitchen so you don't miss an episode. You can watch In the Test Kitchen on YouTube and Spotify and listen to it wherever you get your podcasts. Can't wait to see you in the Test Kitchen.